Hi, I've had a number of patients just this week ask, how did you get into frequency medicine? And so I thought I would do a quick little tell of that story here. Years ago, I was in a relationship and my then partner had a bad work accident. It was pretty severe and we didn't really know much about concussion at the time. And he was misdiagnosed and the whole concussion was missed. And then 3 years later, there were so many changes in his brain that he was trying to get into a grad program and do like a science program, a PhD, and ended up realizing like he couldn't even look at the phone without getting a migraine that lasted up to 3 days, and would go into like a grocery store and have a panic attack. And so symptoms were severe and he got some medical help. He got some opinions from medical providers, and one neuropsych evaluation concluded that it was pretty dismal. It was like, you'd be lucky to make it through a community college art class. Good luck trying to get into grad school was kind of the prognosis. And it was just like horrible. It was just terrible. And actually, so this is how we found Dr. Carolyn McMakin. And he ended up getting in to see Carolyn McMakin herself in her clinic before she had the beautiful Troutdale clinic down in Oregon. And she had, I don't mean to set a precedent for you, Dr. McMakin, if you ever see this, but she had scheduled him for an hour and she saw him for almost 3 hours, or almost 4 hours, and sent him home with a home unit, a custom care that he could treat himself with. And long story short, he ended up getting into grad school, doing a rigorous PhD, getting all A's, and at the end of it came out with a PhD. And so that is a pretty cool story and I enjoy sharing it. And it was just absolutely inspiring to me. My undergrad degree is a Bachelor in Fine Arts and Creative Writing. So I went to an art school. I avoided science and math the first time around. But his story was motivating enough for me to be interested to go back to school and complete prereqs for physical therapy school and become a PT so that I could do Frequency Specific Microcurrent. And I'm so grateful for that whole experience, all of it, even the challenges in it, because it's the most rewarding career I could ask for. And helping people to recover is just the coolest. And there's so much we can do with frequencies. That experience with him really kind of informed my interests. So I always treat the nervous system. I always am looking at how trauma and how experiences that we've had and how we were raised and how vagal tone and the amygdala and the hippocampus, we have frequencies for all of these aspects of the system. It's really my passion to treat the nervous system, just because that was what was such a huge turnaround when I first discovered frequency medicine. And so, yeah, that's my story on how I got started, and it's just been amazing from there to grow my practice and evolve how I work frequencies into supporting people heal from chronic and acute injuries and challenges with their health. And this is truly the future of medicine, so stay tuned. There's no doubt in my mind this isn't going to be like a first line modality, and hopefully in institutions, medical institutions. But in the meantime, if you're looking for a practitioner, or if you're a practitioner looking to learn more about this modality, I'm available for free consults. You just go to resonantequus.com/booking and book a free consult, and I'm happy to try to connect you with someone who's local to you or get you educated on how to learn about frequency specific microcurrent. Be well.